Welcome to Nclex Made Easy 91. In this video, we present another top 50 carefully prepared Nclex style questions on nutrition to help you study smarter and build confidence for your exam. These questions focus on key areas every nurse must know, from digestion and absorption to electrolytes, therapeutic diets, nutrition across all ages, and important deficiency signs. Stay with us, practice actively, and let's get started. 1. Which type of milk is secreted during the first few days after delivery and is rich in antibodies? A. Colostrum. B. Foremilk. C. Hind milk. D. Transitional milk. Answer A. Colostrum. Rationale: colostrum is produced in the first 3 to 5 days, high in protein and antibodies, especially IgA. Strategy: think colostrum comes first. 2. Which milk fraction is higher in fat content and comes at the end of a feeding session? A. Colostrum. B. Foremilk. C. Hind milk. D. Transitional milk. Answer C. Hind milk. Rationale: hind milk is rich in fat and calories, helping satiety and weight gain. Strategy: hind equals high fat. 3. Foremilk is characterized by A. Higher lactose and protein, lower fat. B. Higher fat, lower lactose. C. High antibody content only. D. No nutritional value. Answer A. Higher lactose and protein, lower fat. Rationale: foremilk quenches thirst and provides immediate carbohydrate. Strategy: 4 equals for thirst. 4. The letdown reflex in breastfeeding is triggered by release of A. Oxytocin. B. Prolactin. C. Estrogen. D. Progesterone. Answer A. Oxytocin. Rationale: oxytocin causes contraction of myoepithelial cells, ejecting milk. Strategy: oxy equals outflow. 5. Which hormone primarily stimulates milk synthesis? A. Oxytocin. B. Prolactin. C. Cortisol. D. Aldosterone. Answer B. Prolactin. Rationale: prolactin from the anterior pituitary promotes milk production. Strategy: prolactin equals pro-milk making. 6. The appropriate complementary feeding age recommended in the note is A. 4 to 6 months with continued breastfeeding to 2 years. B. 2 months only. C. 1 year with no breastfeeding. D. 6 weeks with formula only. Answer A. 4 to 6 months with continued breastfeeding to 2 years. Rationale: WHO guidelines advise introducing safe complementary foods at 4 to 6 months while breastfeeding continues. Strategy: remember 4 to 6, then mix. 7. Which measurement is most useful for detecting chronic malnutrition in children? A. Height for age. B. Weight for length. C. Mid-upper arm circumference only. D. Head circumference for age. Answer A. Height for age. Rationale: stunting from chronic malnutrition shows as low height for age. Strategy: height history shows chronicity. 8. Which index best identifies wasting acute malnutrition? A. Weight for length. B. Height for age. C. BMI for age and adults only. D. MUAC for age only. Answer A. Weight for length. Rationale: weight for length reflects body mass relative to stature for acute malnutrition. Strategy: weight now versus height now equals acute. 9. MUAC is considered most reliable for A. Children 6 to 59 months. B. Newborns. C. Adults only. D. Pregnant women. Answer A. Children 6 to 59 months. Rationale: MUAC is a quick field screening for undernutrition in this age group. Strategy: mid-arm for mid-age kids. 10. Which MUAC value indicates severe acute malnutrition in children? A. Less than 11.5 centimeters. B. 12 to 13 centimeters. C. 15 centimeters. D. Greater than 13.5 centimeters. Answer A. Less than 11.5 centimeters. Rationale:
MUAC less than 11.5 centimeters is WHO's cutoff for severe acute malnutrition in 6 to 59 months. Strategy: remember, 11.5 equals emergency. 11. Length is measured in the recumbent position for children: A, under 2 years or less than 87 centimeters, B, over 5 years, C, above 1.5 meters, D, only if sick. Answer: A, under 2 years or less than 87 centimeters. Rationale: lying down avoids posture errors in young children. Strategy: small kids lie down.
12. Which historical figure is credited with proving citrus fruits prevent scurvy? A. James Lind. B. Lavoisier. C. Pasteur. D. Florence Nightingale. Answer: A. James Lind. Rationale: in 1747, Lind's controlled trial showed citrus prevented scurvy in sailors. Strategy: Lind loves limes. 13. Which historical figure is known as the father of modern nutrition and metabolism studies? A. Antoine Lavoisier. B. Hippocrates. C. William Harvey. D. Joseph Lister. Answer: A. Antoine Lavoisier. Rationale: Lavoisier measured oxygen use and related it to metabolism. Strategy: Lavoisier equals lab oxygen. 14. Which measurement is least affected by dehydration in acute illness? A. Height. B. Weight. C. MUAC. D. BMI. Answer: C. MUAC. Rationale: MUAC reflects muscle/fat mass and is less sensitive to hydration status. Strategy: arm size stays stable. 15. The mean extracellular cation is A. Sodium, B. Potassium, C. Calcium, D. Magnesium. Answer: A. Sodium. Rationale: sodium controls ECF volume and osmotic balance. Strategy: Na+ equals outside. 16. The main intracellular cation is A. Potassium, B. Sodium, C. Chloride, D. Magnesium. Answer: A. Potassium. Rationale: potassium is critical for cell function and nerve impulse. Strategy: K+ equals inside. 17. The main extracellular anion is A. Chloride, B. Phosphate, C. Bicarbonate, D. Sulfate. Answer: A. Chloride. Rationale: chloride balances sodium in the ECF. Strategy: Na and Cl go together outside. 18. Which vitamin is essential for clotting factor synthesis? A. Vitamin K. B. Vitamin D. C. Vitamin E. D. Vitamin C. Answer: A. Vitamin K. Rationale: vitamin K enables gamma carboxylation of clotting factors. Strategy: K for coagulation. 19. Which vitamin is synthesized by gut bacteria? A. Vitamin K. B. Vitamin C. C. Vitamin D. D. Vitamin A. Answer: A. Vitamin K. Rationale: colon bacteria produce menaquinone, a form of vitamin K. Strategy: K comes from colon. 20. The deficiency disease of vitamin K in newborns is A. Hemorrhagic disease of the newborn, B. Rickets, C. Scurvy, D. pellagra. Answer: A. Hemorrhagic disease of the newborn. Rationale: lack of gut bacteria and poor placental transfer predispose newborns to bleeding. Strategy: no K equals no clot. 21. Which fat-soluble vitamin can also be synthesized in the skin by sunlight exposure? A. Vitamin D. B. Vitamin A. C. Vitamin E. D. Vitamin K. Answer: A. Vitamin D. Rationale: UVB converts 7-dehydrocholesterol to cholecalciferol in skin. Strategy: sun delivers D. 22. The plant-derived form of vitamin D is called A. Ergocalciferol or D2, B. Cholecalciferol or D3, C.
calcitonin. D. Retinol. Answer A. Ergocalciferol or D2. Rationale: ergocalciferol is found in plants while D3 is animal-derived or from skin synthesis. Strategy: ergo to earth, plants. 23. The main clinical feature of rickets in children is A. Bone deformities such as bow legs, B. Petechial rash, C. Enlarged liver, D. Eye lesions. Answer A. Bone deformities such as bow legs. Rationale: vitamin D deficiency leads to poor bone mineralization. Strategy: rickets bends bones. 24. In adults, vitamin D deficiency manifests mainly A. Osteomalacia, B. Kwashiorkor, C. pellagra, D. marasmus. Answer A. Osteomalacia. Rationale: poor bone mineralization in adults causes bone pain and fragility. Strategy: adults get soft bones. 25. The vitamin known as nicotinic acid is A. niacin, B. thiamine, C. riboflavin, D. folate. Answer A. niacin. Rationale: niacin is vitamin B3, important in NAD and NADP synthesis. Strategy: niacin equals nicotinic acid. 26. The deficiency disease of vitamin A is A. pellagra, B. scurvy, C. beriberi, D. night blindness. Answer A. pellagra. Rationale: pellagra presents with dermatitis, diarrhea, and dementia. Strategy: 3 Ds equals pellagra. 27. The amino acid precursor of niacin is A. tryptophan, B. lysine, C. methionine, D. phenylalanine. Answer A. tryptophan. Rationale: tryptophan can be converted to niacin with adequate vitamin B6. Strategy: T for tryptophan to T for 3Ds prevention. 28. The deficiency disease of vitamin C is A. scurvy, B. pellagra, C. beriberi, D. rickets. Answer A. scurvy. Rationale: vitamin C deficiency impairs collagen synthesis, leading to bleeding gums, petechiae, and poor wound healing. Strategy: C for collagen. 29. Which mineral is essential for thyroid hormone synthesis? A. iodine, B. iron, C. selenium, D. zinc. Answer A. iodine. Rationale: iodine is a component of thyroxine, T4, and triiodothyronine, or T3. Strategy: I for iodine, I for iodothyronine. 30. The enlargement of the thyroid gland due to iodine deficiency is called A. goiter, B. cretinism, C. myxedema, D. Graves' disease. Answer A. goiter. Rationale: low iodine reduces hormone synthesis, stimulating TSH and gland growth. Strategy: no iodine equals neck swelling.
31. Which mineral works with vitamin E as an antioxidant? A. selenium, B. magnesium, C. calcium, D. phosphorus. Answer A. selenium. Rationale: selenium is a cofactor for glutathione peroxidase. Strategy: C plus E equals antioxidant team. 32. The most abundant mineral in the body is A. calcium, B. magnesium, C. sodium, D. potassium. Answer A. calcium. Rationale: calcium is mainly stored in bones and teeth. Strategy: bones equals calcium bank. 33. A deficiency of folate in pregnancy can cause A. neural tube defects, B. night blindness, C. pellagra, D. osteomalacia. Answer A. neural tube defects. Rationale: folate is critical for DNA synthesis during fetal neural development. Strategy: F for folate, F for fetal spine. 34. The main storage form of carbohydrate in the body is A. glycogen, B. glucose, C. starch, D. cellulose. Answer A. glycogen. Rationale:
Glycogen is stored in liver and muscle for short-term energy. Strategy: G for glycogen, G for glucose reserve. 35. Which vitamin acts as a coenzyme in transamination reactions? A. Vitamin B6, B. Vitamin B12, C. Vitamin B2, D. Vitamin C. Answer: A. Vitamin B6. Rationale: pyroxidyl phosphate is needed for amino acid metabolism. Strategy: B6 builds amino acids. 36. The earliest sign of vitamin A deficiency is A. Night blindness, B. Xerophthalmia, C. Keratomalacia, D. Corneal ulceration. Answer: A. Night blindness. Rationale: vitamin A is essential for rhodopsin in the retina. Strategy: no A equals no night vision. 37. Which vitamin deficiency can result from long-term antibiotic use due to gut flora suppression? A. Vitamin K, B. Vitamin D, C. Vitamin E, D. Vitamin C. Answer: A. Vitamin K. Rationale: antibiotics reduce bacteria that produce vitamin K. Strategy: kill bacteria, kill K source. 38. Which mineral is the main intracellular magnesium storage site? A. Bone, B. Liver, C. Brain, D. Adipose tissue. Answer: A. Bone. Rationale: about 60% of magnesium is stored in bone. Strategy: bones bank both Ca and Mg. 39. Which vitamin is also known as cobalamin? A. Vitamin B12, B. Vitamin B6, C. Vitamin B2, D. Vitamin B1. Answer: A. Vitamin B12. Rationale: cobalamin contains cobalt and is essential for RBC formation. Strategy: B12 equals cobalt's core. 40. Deficiency of vitamin B12 leads to A. Megaloblastic anemia, B. Microcytic anemia, C. Scurvy, D. pellagra. Answer: A. Megaloblastic anemia. Rationale: B12 deficiency impairs DNA synthesis in RBC precursors. Strategy: big cells equal B12 lack.
41. Which carbohydrate is indigestible and aids bowel regularity? A. Cellulose, B. Starch, C. Glycogen, D. Maltose. Answer: A. Cellulose. Rationale: cellulose is a dietary fiber. Strategy: cellulose sweeps the colon. 42. Which vitamin enhances iron absorption from plant sources? A. Vitamin C, B. Vitamin D, C. Vitamin K, D. Vitamin B2. Answer: A. Vitamin C. Rationale: ascorbic acid reduces ferric to ferrous iron for absorption. Strategy: C converts iron. 43. Which mineral is necessary for insulin function? A. Chromium, B. Calcium, C. Sodium, D. Zinc. Answer: A. Chromium. Rationale: chromium enhances insulin receptor activity. Strategy: chrome polishes insulin's job. 44. Which vitamin acts as a cofactor for prothrombin synthesis? A. Vitamin K, B. Vitamin E, C. Vitamin A, D. Vitamin C. Answer: A. Vitamin K. Rationale: vitamin K activates clotting factors including prothrombin. Strategy: K kicks off clotting. 45. The principal storage form of vitamin A in the body is A. Retinol esters in the liver, B. Retinol in the skin, C. Beta-carotene in the intestine, D. Retinol in the retina. Answer: A. Retinol esters in the liver. Rationale: liver stores vitamin A mainly as retinol esters. Strategy: A lives in the liver. 46. Which vitamin can be stored in significant amounts in the liver for several years? A. Vitamin B12, B. Vitamin C, C. Vitamin B6,
D. Folate. Answer A. Vitamin B12. Rationale: B12 stores can last 3 to 5 years. Strategy: B12 equals big bank and liver. 47. Which mineral is vital for hemoglobin synthesis? A. Iron. B. Iodine. C. Sodium. D. Zinc. Answer A. Iron. Rationale: iron is part of the heme group that binds oxygen. Strategy: iron carries air. 48. Which vitamin deficiency causes beriberi? A. Vitamin B1. B. Vitamin B2. C. Vitamin B6. D. Vitamin B3. Answer A. Vitamin B1. Rationale: thiamine deficiency causes wet or dry beriberi. Strategy: B1 equals brain and heart energy. 49. Which vitamin is also known as riboflavin? A. Vitamin B2. B. Vitamin B3. C. Vitamin B5. D. Vitamin B7. Answer A. Vitamin B2. Rationale: riboflavin is essential for FAD and FMN coenzymes. Strategy: B2 equals bright yellow riboflavin. 50. Riboflavin deficiency is characterized by A. Cheilitis and glossitis. B. Night blindness. C. Rickets. D. Pellagra. Answer A. Cheilitis and glossitis. Rationale: B2 deficiency causes inflammation of lips and tongue. Strategy: 2 lips equals B2. Great work completing this session with us here at Nclex Made Easy 91. You've just practiced 50 tough Nclex style questions on nutrition, and every step like this brings you closer to exam success. Keep revising, keep practicing, and stay consistent. Success is built one question at a time. Don't forget to like, share, and subscribe so you won't miss the next set of practice questions. Until next time, keep learning and keep moving forward.